A hearty good evening and welcome to the session on pregnancy post IVF. We are glad to have Dr. Suyash among us today to help us understand the topic. He will take us through that and more in this session today. Doctor, you have the stage.
Thank you. Thank you for the kind introduction. I am Dr. Suyash Bhandekar. I am a IVF consultant and a laparoscopic surgeon at Apollo Fertility Center, Thane. So, today's session is dedicated to all the pregnant ladies out there who have conceived through a lot of efforts in their infertility journey. Maybe it's an IUI or an IVF. So we come across a lot of patients who are like conceived or who have conceived recently and they want to know how would be the course ahead post an IVF or post an IUF. So this session I would dedicate to them because this is really an important topic to touch on. So as we all know, it's like a very tiring journey. It's like these girls, these ladies have gone through a lot before getting that good news of yes, they have conceived. So that is, I'll say, that is the bestest news that they have heard. And once they come across that uh, report, which multiple number of times they might have seen as negative, but this time it is positive. Yes, beta is positive. So post that also they have a lot of anxiety. They are like really happy, and it's like the final wait is over. But no, this is not the wait. The wait is still there, and that is on 9 months of pregnancy. So how do we go ahead? So basically, once you get your beta HCG positive, we usually see our physician or the clinician who is taking care of you. So I'll just like to address certain points into this, which is really, really important to you to understand. So first of all, once you get your beta HCG report as positive, so we usually repeat it again. I think after 48 hours. The basic intention is like, see, even if your beta HCG is positive, yes, you are 100% pregnant, but even if I do a scan for you at that particular moment, the pregnancy is not seen because it's like a very early microscopic surgery that is there. So it won't be visualized on the ultrasound. So hence we have to repeat your beta ECG and it will be on an increasing trend. So doctor, when do we do the ultrasound? Because everybody is like waiting for the baby and the baby's heartbeat to be seen. So ideally, we suggest to be done at around 6 to 7 weeks. So once you get your beta HCG positive, usually post an embryo transfer. After 14 days, that is after 2 weeks, we ask you to do your beta HCG, right? So that is your 4 weeks of pregnancy. So you will have to still wait for another 2 weeks to see the ultrasound. And at 6 to 7 weeks, we usually come across to see the baby, whether it's like a single pregnancy or a twin pregnancy, and whether the baby's heartbeat is seen or not. So yes, there is another wait for 2 weeks. Okay. Before that, I would address you certain points which are actually very necessary. So coming to that, especially those who have undergone a frozen embryo transfer or an fresh transfer, maybe. So these girls, these ladies have to continue with all the medicines. Okay, because see, your pregnancy is dependent on the medicines as of now. You have been given a hormonal support to certain extent, which you have to continue, and this will be continued till 12 weeks of pregnancy. Because by around 12 weeks of pregnancy, your placenta is take care of the parameters for your pregnancy. So make sure you're not skipping any of the medicines. Considering yes, your beta HCG is positive, अभी तो pregnancy आ गई, अभी इतने सारे medicines कौन लेगा? You still have to continue it for good 3 months. That is still first trimester of yours. Secondly, according to that, जैसे कभी भी सर्दी खांसी जुकाम हो जाता है, तो we usually rush to our any pharmacy store and we is there a safer version of antibiotics. All right. So medicines are to be taken on a regular basis till at least first trimester or till your clinician suggests you. Okay. Second to that is the most common question that we come across, doctor, what are the restrictions now since we are pregnant? What are we going to do? What is to be avoided? What are the do's? What are the don'ts? So remember one thing, you are just pregnant. Being a lady yourself, you are destined to be a mother, you have to go through that womanhood, the motherhood part. It's a normal phase of your life. Yes, but there are certain restrictions that we usually suggest. One is like do not lift weights, like not more than 5 or 6 kgs. Avoid too much of traveling, like far distance traveling, like if you want to go for 200, 300 kilometers by car or so. If it is not urgent, avoid it. Third, refrain from having intercourse for next 3 months. Apart from that, there are no restrictions. So there are multiple couples who come across. They tell me कि ये गर्म है, ये ठंडा है, ये खा सकते हैं, नहीं खा सकते. You can have each and every food, but that should be locally available and it should be in normal regular limit. जहाँ पे भी आप ज़्यादा करोगे वहाँ पे नुकसान हो सकता है. So you are permissible to have everything, veggies, non-veg, whatever you like. You can also have food from outside. Sometimes you may have that craving, which is normal. In first trimester, girls get craving once they are pregnant. So you may have craving for eating Domino's ka pizza or burger. You may still have it. You can have it, no problem. The only thing is, yes, whenever you're having, make sure that you use having it from a good hygienic source, because we don't want you to have loose motions, vomiting, and on the top of it, you see you're already taking so many medications, and from on the top of it, you will be going giving medicines for that loose motion or vomiting, right? So whatever things are avoidable, better to avoid it. Coming to the next thing is like, see, there are certain signs or symptoms, I would say, which once you get pregnant, you'll come across. Like one is like you'll have a lot of fatigue. You may have a lot of desire to sleep. There's excessive sleepiness that comes. So that is because your beta hCG levels are rising. You may still have some cramps in your lower abdomen, just like you before you get your periods. Those are also normal. All right. In the evening or at night time, you might feel that you have fever. Your body is really warm. But if you take your temperature, the temperature is not there. It is hardly 98, 99. So these are all normal changes. You may experience some sudden hair fall. There might be some pimples on and off that may erupt on and off. You may have mood swings. That is also normal. So these are all normal changes that you'll experience, especially in the first trimester. Post that, two important things in which we usually suggest to report to your clinician, that is severe pain in abdomen, or in case if you have spotting or bleeding. We do not expect any spotting or bleeding to happen in this entire 9 months of journey. But in case if you have any, you have to report to a clinician ASAP. One more thing which I would like to add, because we have a lot of patients coming from the IT sector and who have like a lot of desk work. So they are like more into sitting and sitting and sitting. So we usually do not recommend them to leave their jobs. Please don't do that. There is absolutely no need. You can travel to your job place whether it's like within that limit. And if you have a desk work, so what we usually recommend is at least get up every 1.5 to 2 hours, go have some water, go to the loo, talk to your friends, and then come back. If you have prolonged sitting for 4 to 6 hours, 8 hours, especially during your pregnancy period, you may have a lot of back pain. So you have to take care of that particular thing. Secondly, if you are more, see, your job needs your laptop or a desk, maybe a computer, so you're exposed to a lot of radiation. So in that case, see, that is a non-negotiable part, right? You have to work. But yes, your mobiles, even that is going to give you radiation. A lot of social media is there, Insta, Facebook, WhatsApp, so that is avoidable. So in that case, I would suggest you have to work with your laptops, computers, you have to work, you use it. But rest of the times, avoid the social media. That is avoidable, right? So take care of that particular thing. So with that, we go ahead with the second part of the pregnancy. So once you get your beta hCG positive, we do a scan at the 6 7 weeks, and balle it's pregnancy. It might be a single pregnancy, or we may have conceived with twins. Baby's heartbeat is positive, right? So that's very good news. So we usually recommend you doing your scans every 2 weekly for it, especially in the first trimester, because like it's a very small pregnancy, and the only way we can assess how the pregnancy is growing is by doing subsequent scans. So till first trimester, yes, we are expecting some. There might be some issues that might happen in the first trimester, which should be picked up at the right time. So scans every 2 weeks for the first trimester. You may also have some nausea, vomiting, which may come up at the 7th, 8th weeks, which might continue in the first trimester as well. So almost 60-65% of the girls do have it. So that is a normal part and parcel of your pregnancy. Now you have to accept it. So coming to the end of the first trimester, that is around 11 to 13 weeks, we usually recommend you doing a NT-NB scan. That is a early anomaly scan. So basically, we are going to evaluate the baby completely from head to toe. Every detail of the baby is going to be seen. So that usually takes a lot of time. It may happen within 15-20 minutes, or it may take almost like half an hour, 1 hour also, depending on the profile of the baby. Once that is done, we usually recommend you doing a double marker test. That is a blood test. See, basically, scans are going to give us the physical evaluation of the baby. But what about the mental thing of the baby, right? We have to evaluate that also. Especially, we have a lot of ladies who are in their post 35s and 40s who are opting for IVF now. So that particular element has to be taken care of. We have to respect your biological age, right? So your double marker is a screening test. It's a blood test which is going to give us a basic idea whether the baby's mental health is in a proper way. So in case, because we usually see this, in case if the risk is on a higher side or it is intermediate side, you may need to go ahead with a confirmatory test, that is a NIPT or a amniocentesis. I wouldn't go in much detail about it because that is not necessary. All right. So once you are done with the NTNB scan and double marker test, you go ahead with the second trimester. So now the good thing is once you have completed 12 weeks, we stop all your medications. Only if needed, we may add you with certain medicines. Your folic acid, your iron, calcium may be given by your clinician. That usually goes ahead. So that is to be taken till 9 months of pregnancy. So now coming to the second part of the pregnancy, yes, you may need vaccinations also. Normally, what vaccinations we usually suggest is like the TT vaccination. There's a DNT combination that is available now. Second is the hepatitis B vaccination. If you have not been immunized prior, so it's always better to take the hepatitis shots. There's a flu vaccine that is usually recommended during your pregnancy, and the booster shot that has to be given in the last trimester. So this will be taken care by your physician for the same. At the end of the fifth month, we usually do the last detailed scan report, that is the anomaly scan. And in case if you have not done your double marker, in that case, we usually suggest you going ahead with the quadruple marker test. So basically, quadruple marker is also the screening test to evaluate the mental thing of the baby. So once you have completed your 5 months, we usually what we usually have seen is like 4, 5, 6, 7 month, and to some extent the 8 month also is like really comfortable. You girls, ladies may not have any symptoms. It would be like just a normal phase of your life. You will actually enjoy that phase of life. Baby movements, yes, you might feel by around 22 to 24 weeks, you'll feel like slight tingling thing that is happening inside your tummy. But that's like a beautiful moment that is happening. And maybe in the seventh or the eighth month, you'll have like tight clicks that might happen to you. So that is just a normal thing that we expect. And with that kicks, I should tell you that the baby movements should be really a matter of concern. We usually suggest you to keep a record of the baby kicks that are happening in a day. So on a thumb rule, what we usually say is like at least 15 movements, 1 5 movements in a day should be adequate. So these movements may happen all together in the morning or in the evening or at night, especially once you have your food and once you're like lying down, when you're relaxed, that time you might feel more of baby movements. But remember one thing, it should happen at regular intervals. ऐसा नहीं होना चाहिए कि 12 घंटा 16 घंटा हो गया and you are not able to feel any movements. So that is not right. Yes, but थोड़ा थोड़ा movement हो रहा है at regular intervals, that is what we want. So coming to the third trimester, once you have entered your 7 month, you can do a 3D scan if you want to go ahead. Or normally it's like a gross scan. We just want to know what is the baby's weight. By 7 month, we expect baby's weight to be around 1 kg. But if you want to go ahead with the 3D scan, they can show you a beautiful picture of the baby's face, baby's heart can be seen in a really nice way, and you can just have it as a sort of memory for you. Next scan will be in the 9th month, like around 35 to 36 weeks, and that would be mostly your last scan. Um, that is a color Doppler scan. Basically, we want to evaluate the blood supply is happening in a proper way to the baby. So once you are done with that 36, 37 week scan, then is the time for the most important thing, that is the delivery. So remember one thing, It's never a C-section. So see, IVF was done for you because you were not able to conceive, right? It was not because you are not able to deliver. So irrespective whether you have conceived with an IUI or it's a natural conception or an IVF conception, if things are permissible, you can still deliver in a normal way. There is no thumb rule that if it is an IVF conception, you have to go ahead for C-section. Yes, but there are multiple things that has to be taken care of, like your age, whether it's a single pregnancy or a twin pregnancy, whether there are already medical issues associated like diabetes, hypertension, or any other medical issues that have been come up in the pregnancy, like a pregnancy-induced hypertension or diabetes for that matter. So these all parameters have to be taken care of, and then your clinician will be suggesting you, yes, this is a proper way of going ahead for a delivery. But nowhere it is like you cannot deliver in a vaginal way. C sections, yes, they are more comfortable nowadays, more sophisticated, and like most of the females do deserve for it. But that's okay. It's completely your call, I would say. And one more thing which I missed out in the second trimester is maybe sometimes the cervical length may get short during your in the earlier the second trimester. In that case, especially with the twins in situ, in that case, you may need a cervical stitch to be put. So that your clinician will be suggesting you. So usually the stitch has to be put vaginally and that is to be put internally. So there won't be any cut or stitches over your private parts or the abdomen at that particular time. But yes, you may need it. So your clinician will be taking care of that. With that, I would like to conclude my session. I wish all the very best for the IVF pregnant patients and hoping to you to have a blissful pregnancy ahead and getting delivered in a normal way. And to those who may go ahead with an IVF or any infertility procedure for that matter, remember one thing: everything is happening for a cause. You should be okay with it, accept it, and yes, things will be really really sorted. Wishing you all the very best. In case if you have any concern, feel free to connect to us. We're always there to help you out. Thank you so much.